Cancer diagnosis, treatment, and care is a special problem in the Salinas Valley. Cancer is the #1 cause of death in Latinos. The population of our county is now 60.4% Latino. However, cancer resources for poor Latinos and farm workers are very thin.
For example, Natividad Medical Center, so admirable in so many ways, consistently providing culturally appropriate medical care and guidance, does not treat cancer. This local treater of last resort does not provide medical treatment for cancer, the top cause of death for the majority ethnicity in the county. The local nonprofit Cancer Patients Alliance has been working in this area for more than 15 years. Their view is that this lack of cancer treatment and care produces local fragmentation in cancer diagnosis and treatment that can lead to real-world suffering and death. We present the following 3 examples of individuals with cancer, which are emblematic of the types of issues that local Latinos with cancer face on a regular basis. We introduce you to 57-year-old Latina Martha Lopez.
Mi nombre es Marta Alemán López. Tengo 4 hijos, tengo 3 hombres y una mujer. Hace 3 años exactamente me diagnosticaron que tenía cáncer de riñón. Y estoy así porque no me quisieron ayudar en la Asociación Americana del Cáncer. Yo llamé allí y en otras partes que me dio la trabajadora social para que llamara, para ver si me podían ayudar, y no me ayudaron. Y hasta ahorita no sé qué hacer, porque no entiendo por qué no nos daban pues la ayuda de la América. Yo empecé con un pequeño dolor del lado izquierdo en mi cintura y en un día se incrementó demasiado en lo que yo no aguantaba el dolor. Recaía pues al piso y me doblaba toda porque no aguantaba el dolor. Entonces mi esposo decidió llevarme al hospital de emergencia. Y allí en el hospital el doctor que estaba de guardia me dijo que me iban a meter a hacerme un MRI, a ver qué era lo que tenía. Y después del MRI, cuando me llevaron para atrás al cuarto, me mandaron a hacer un ultrasonido y también me sacaron unas placas, pues unos rayos X. Y ya el doctor me dijo que lo que tenía el diagnóstico que tenían era que era cáncer. Entonces, cuando fui a la cita del doctor, él me dijo que, luego en cuanto me miró, me dijo, tienes cáncer en el riñón izquierdo, se te va a tener que sacar el riñón inmediatamente, que al cabo tú vives sin un riñón. Y le dije, doctor, pero yo soy diabética, pero no me has hecho una biopsia para saber qué clase de cáncer tengo. Dijo, no es necesidad, nomás es operar, sacarlo y sí sobrevives. Fue lo único que él me respondió así. Y me quedé igual, en shock, porque no me ayudó eso para nada. Y me dan mucha medicina para lo de la infección de orina y sí, nada más para lo único que me han dado para eso y también para el dolor, pastillas para el dolor nada más. Pero lo único que me han dicho es de que me tengo que esperar y tengo que ver quién me puede ayudar, nada más. Quiero saber exactamente qué es lo que tengo. No tengo miedo a llevar la enfermedad, no tengo, porque tengo exactamente 3 años que estoy así. ¿Qué es en realidad, qué clase de cáncer tengo? No sé qué clase de cáncer tenga. Dijo el doctor así, que el riñón grande, el riñón es donde están ya más grandes los tumores, ya están más grandes, y que probablemente el otro ya esté un poco dañado. Pero tú sabes que cuando te van a meter a hacer nomás, ellos nos diagnostican una sola cosa, a lo que van. Y le dije, porque yo he tenido dolores en el otro riñón, dijo, probablemente, es muy probable que sí se pueda transmitir, pero esperemos que no. Dice, pero si ya tienes dolores, son síntomas que pues tú ya conoces los síntomas, así nomás me dijo. La verdad se siente uno defraudado porque como yo a mi pensar es esto, yo digo, yo todo el tiempo he trabajado, toda mi vida, yo he trabajado, siempre he dado lo que yo puedo, trabajo, porque a mí sí me gusta trabajar. Y ahora cuando yo lo necesito te dan la espalda. Sí.
An update on Mrs. Lopez's journey is that we were able to help her enroll in Medi-Cal. She then underwent surgery at Stanford University, which removed a cancerous tumor in her left kidney. Mrs. Lopez has since sought aid from various social service programs and grants. We hope that Mrs. Lopez will continue to receive the care and resources she needs to face this challenging time in her life. Catherine Razzo is the daughter of Maria Gomez, a 53-year-old Latina.
My name is Catherine Razo Gomez, and I am the daughter of Maria Gomez Leon. January of 2020, my mother started feeling some pain in her stomach. Early year of 2020 in January, she was going to her primary care physician. The initial results were based off of, the symptoms that my mother was having, which was just the stomach pain. It started progressing to the point where it was very difficult for her to keep food in her stomach because of the pain that she was having. It was in early March, at the beginning of March, when my mother started going to the emergency room. We then proceeded to take her to the emergency room at Memorial Hospital, in which, again, they did not know what was going on. They did some tests, they ran some tests, and that's when they told us that she potentially had some enlarged lymph nodes or cancer. They didn't know what it was. Our question was, well, you as a doctor, as a medical practitioner, what do you recommend the next steps be? Which the doctor also did not know. And so we were sent to the oncology center at Salinas Valley Memorial Hospital, and from there, that's when we started to get denied in services because there wasn't a pre-evaluation of my mom that was done. That being, the results were given that she potentially had cancer. We were sent over to the oncology center at Salinas Valley Memorial Hospital, but we weren't explained of the process of what it was to be able to be seen as a patient. We were advised that we needed to get her a biopsy to be able to identify if it was cancer or not. From Memorial, we received the results, and that's when the oncology center at Salinas Valley Memorial Hospital was able to treat her as a patient and start a treatment plan, which at first they had denied because my mom did not have insurance, and they were not willing to take us in without an insurance, even though we advocated and we let them know that we would make ourselves financially responsible for all of the medical treatment. Mother started treatment in April of 2020, about a month later after her diagnosis, April 2020, and that consisted of getting MRIs done, PET scans, and starting chemotherapy. And as she continued with her chemotherapy and continued with getting PET scans done, that's when the doctor noticed that my mom's cancer traveled from her stomach to her pelvic bone, where, as the doctor described, about 20% of my mom's pelvic bone was had cancer cells present. My mom's time frame, because of the severity of the type of cancer that she had, it was an aggressive type of cancer. They were giving her 4 to 6 months to live. Her health started to deteriorate again, and we continued with the visits to the emergency room at Memorial Hospital where she would stay in the hospital for about a week, not being able to control the different pain that she was receiving. It was in December of 2021 when the doctors diagnosed her with cancer in her brain. When we received the news, we both sat in the doctor's in the room, and we held hands and we started to cry, and that was that. We cried and we went home. We felt a lot of anger with the medical system. We felt like my mom's case with being diagnosed with cancer was not as important as other cases because she wasn't being seen, she wasn't being treated. It took 4 visits to the emergency room at Natividad and a lot of advocacy from my mom, a lot of advocacy from myself, from my family, from support from other community members and friends for her to be treated. So I felt frustrated with the medical system, with the fact that my mom did not have insurance at first, and making that association between not having insurance and not being seen when she should have been seen. And then, going through the process of getting her insurance, and as soon as she had insurance, things started to speed up, things started to pick up. We were able to see the doctors that we needed to see.
We are deeply saddened to inform our viewers that Mrs. Gomez passed due to her cancer on January 8th, 2022, only 5 months prior to this filming. Our final interview is with Mrs. Cárdenas, a 56-year-old Latina.
Mi nombre es Inés Cárdenas, y tengo 4 hijos. Y encontré una doctora y me revisó el cuello y me dijo ella, déjame revisar porque creo que tienes algo aquí o tienes un problema de tiroides, probablemente tengas cáncer. Yo automáticamente sentí que ya estaba muerta. Wow. Y ella dijo, tienes que ir a un doctor especialista en tiroides para que él detecte qué está sucediendo contigo. Me dijo, ¿sabes? Te quiero decir algo. Probablemente te van a detectar cáncer en este país, pero solo cuando ya estés en tal vez una fase terminal, y probablemente entonces sí te puedan ayudar. Me dijo, yo creo que vas a tener que irte. Si tienes opción, ve a tu país, tal vez te puedan salvar la vida. Y le dije, ¿pero por qué me tengo que ir? ¿No pueden ayudarme? Dijo, no creo. ¿Fuiste a Medical? Sí. ¿Te van a ayudar? No. Yo me fui, porque aquí no me pudieron ayudar. 1 año tuve que irme. Llegó a México y él dice, tienes cáncer en tu tiroide, porque aquí aparece, por mi experiencia, aparece un nódulo grande en la parte de aquí, y dijo él, hay que operar lo más pronto posible. En 1 mes que llegó a México, él hace la operación. Doctor, lamentablemente tu cáncer se extendió a la otra parte de la tiroides. La vamos a remover porque solo habían removido una parte y removieron la otra parte, porque tú tienes que regresar a tomar una cápsula de yodo radioactivo en el hospital de cáncer. Y probablemente me dijo el doctor que tienen que hacerme una biopsia para que se pueda detectar a tiempo si el cáncer ha regresado. Pero no he tenido oportunidad porque no tengo aseguranza y porque tengo que ahorrar un poco de dinero para que me puedan hacer la biopsia. No tengo ningún tipo de aseguranza por lo mismo que pues necesitamos no ganar a lo mejor nada para que te puedan dar la ayuda, o yo no sé, o ser, no sé. Hay exámenes que te detectan el cáncer a tiempo. Nunca me detectó el cáncer. ¿Por qué no lo hizo? ¿Por qué? ¿Qué valía más? ¿De una aseguranza, miles de dólares para que te dijeran, tienes cáncer, te podemos ayudar, puedes salvar tu vida? ¿Por qué no lo hizo? Si él, no solamente a mí, sino a muchas personas, se están muriendo de cáncer, ¿por qué no les dicen a tiempo? ¿Por qué te dicen tienes cáncer cuando estás en fase terminal?
Miss Cardenas did not have insurance, guidance, or support. She was forced to go to Mexico for the treatment of her thyroid cancer. The return of the cancer required a biopsy that she could not afford. Despite years of delay, without too much effort, we were able to get her on Medi-Cal and can report that she has currently been receiving treatment for her cancer, as well as support from her loved ones and Medi-Cal team. We wish her well. Despite what you may hear, that no local patients are turned away by providers, in a practical sense, if our collective experience and these interviews are a guide, this is just not true. Logistic requirements, financial requirements, insurance delays, runarounds, lack of outreach, lack of invitation, lack of guidance, all these and many more factors contribute in a practical way towards not seeing, diagnosing, or treating patients who are vulnerable, in pain, frightened, otherwise suffering, in fact, are often dying.
There are many potential solutions, but one big solution that would solve a number of these problems at one time is for our county hospital to begin offering medical treatment and guidance for cancer, the top cause of death in Latinos.